नमस्ते नमस्ते। बुद्धियुक्तौ जहाति हो उभे सुकृत दुष्कृते तस्मात् योगाय युज्यस्व योगः कर्मसु कौशलम्. I give my salutations to my yoga teachers, Dr. K. Krishna Bhatt, Dr. Ganapati Joyce, and Professor Vigneshwara Marathi. Respected Chairman, Professor Dr. Krishna Sharma sir, and all the members of organizing committee and the participants, a very good evening to all of you. Today, my session is on scope of yoga therapy as complementary and alternative medicine. I'll be sharing the PPT, just a minute. So the contents of my today's presentation, introduction, complementary and alternative medicine, yoga therapy as CAM, scope of yoga therapy as CAM, concepts of yoga therapy with conventional medicine, standardization of yoga therapy, misconceptions in yoga therapy, limitations and applications of yoga therapy, and conclusion. Yoga therapy, yes, is Indian philosophy and has been a part of traditional Indian spiritual practice for millennia. In recent times, the role of yoga has broadened. Yoga has now also become a popular route to physical and mental well-being and has been adapted for the use in complementary and integrative medicines internationally. Yes. There is well-documented evidence for the increasing use of complementary and alternative medicine in the management of disorders. The World Health Organization refers to the rise in the use of non-conventional medicine, meaning traditional, complementary and alternative medicine in nations all over the world in its traditional medicine strategy. Many study reports indicate that complementary and alternative therapies may be more beneficial than conventional therapies. The various types of complementary and alternative medicines, alternative medical system, which developed separately from the conventional medicine like Ayurveda, homeopathy, naturopathy, etc. Mind-body interventions include practices that are based on the human mind, but have effects on the body, physical health. Examples are, yes, of course, yoga therapy. Biologically based treatments, also, it's mainly specialized diets and herbal products. Manipulation and body-based medicines includes therapies that, yes, examples like movements of the body like massage therapy. Energy therapies include the applications of energy fields, examples like Reiki and magnetotherapies. These are the various types of CAM. Yes, yoga is CAM. Let us see a few aspects, how it has been developed. Yoga is an ancient Indian science, is also being used as a therapy in the Occidental cultures, but systematized approaches are seldom published. It has been observed that integration of yoga techniques in routine treatment of disorders shows beneficial results. Also in the 1960s, Western interest in Hindu spirituality reached its peak among the teachers of yoga who were active in the West in this period, were B.K. Iyengar, Pattabhi Joisa, Swami Vishnudevananda, and Swami Sachidananda. A second yoga boom followed in the 1980s. The followers of Swami Sachidananda connected yoga to heart health, yoga as a purely physical system of health outside the counterculture and unconnected to a religious denomination. Since then, yoga has been used as supplementary therapy for diverse conditions such as cancer, diabetes, asthma, and AIDS. The scope of medical issues where yoga is used as a complementary therapy continues to grow. Although yoga is historically a spiritual discipline, it has been used clinically as a therapeutic intervention. Let us see how, the clinical applications or interventions, origin begin at India. Swami Kuvalayananda used yoga as therapy according to modern medicine as early as 1924. Since then, it is being utilized at Kaivalya Dhama, Pune, and other yoga centers in India. And also yoga therapy now is, after that, is emerging as a clinical discipline within the broad category of mind-body medicine, whose growth is consistent with the flourishing popularity of yoga in the West and increasing worldwide use as an alternative medicine. Okay, well, the first methodical medical application of yoga started in India in 1918 at the Yoga Institute of Warsaw near Mumbai, Yoga Institute at Santa Cruz. This was soon followed by the clinical work at Kaivalya Dhamma Yoga Institute in Lonavala under Swami Kuvalayananda in 1920s. We have discussed on that. Consequently, yoga therapy has flourished in India with the establishment of yoga hospitals and clinics. The development has moreover spread all over the world with the presence of yoga therapy centers. From, last 2 to 3 decades for treating even psychiatric patients, mental health professionals have started looking at various complementary and alternate treatments, and yoga has been, thought of as one such possible treatment options. Yoga therapy has now also become a popular route to physical and mental well-being and has been adapted for use in complementary and alternative medicines. Now, with this introduction, let us discuss on scope of yoga therapy in complementary and alternative medicines. As yoga therapy as complementary medicine, of course, yes, when a patient is taking other system medicine as main treatment, yoga therapy can be used as can be used with that treatment for the better effectiveness, so considered as complementary medicine. Yoga therapy as alternative medicine, when the patient says, yes, I don't want to go through that system of medicine, I have been taking that medicine since longer duration, now I want to go for other system of medicine, or I want to go for yoga therapy, yes, then yoga therapy becomes, or you can understand it as alternative medicine with all the limitations in yoga therapy. Also, as integrative medicine, okay, patient, in many disorders, that they will take modern medicine, with that they take Ayurvedic medicine, with that they take naturopathy medicine. So with all those medicines, there will be treatment as prescribed by their physicians or doctors or a therapist. But with those treatments, yoga therapy can be also, yes, given to that patient for the further effects, or for the further healing, for the cure. Also, yoga therapy as preventive aspect, various literatures, yoga literatures, yes, give reference about the preventive aspect of yoga practices, yoga techniques. The preventive aspects are it delays in manifestation of the disorders. It may be it may be about the immunity aspects, maybe genetic or maybe adaptive. In both aspects, yoga practices, they prevent from the manifestations of disorders. If the patients or the hereditary factors are about the diabetes mellitus or hypertension or cardiac disorders, then as a preventive measure, the patient or the person can be advised to practice those yoga specific techniques which will be very effective in those particular disorders. Yoga therapy as rehabilitation treatment or medicine. Of course, after they go through certain disease course with the treatments, further to improve in a better way, so that the further symptoms of the diseases can be minimized, as well as the whatever has been happened with the general health, with the mental health, can be improved, and overall the well-beingness of the patient can be improved. That is by the yoga therapy, as well as it can be considered as supportive aspect when all the treatments patient is under treatment, and if he practices specific yoga therapy in his conditions, then of course it becomes a supportive therapy, and by the regular treatment, patient may ask with his physician or with his treating clinician to reduce the dosage of the medicine, and finally the medicines may be stopped. Only yoga therapy may be continued. Further, see, there are concepts to enhance the scope of yoga therapy. They are drug interaction, as we have experienced for certain disorders, when one system of patient is treated by one system of medicine, if other system of medicines, like other medicines of other systems are given, then there will be drug interactions or drug effects, as if he is taking modern medicine, with that if he starts to take like Ayurveda or other system of medicine, or the same medicine of same system, the first medicine which he is taking, it may not give that effect which it has to give. It may not affect as it has to affect. So that it is understood as drug interaction. But in yoga therapy, that kind of interaction is not there. Whatever patient may be taking drugs for his treatment, yoga therapy will not interfere, or it will not makes change, or will not decrease the effect of their medicinal or pharmacological treatments. So yoga therapy, we know what it will do, as positive, in what way it brings positive health in those patients. And there is no adverse effects in yoga therapy, as we have seen long-term taking of certain medicines, like one example can be given as painkillers. There will be GI tract damage to that patient. So yoga therapy doesn't affect us adverse effects. It doesn't cause adverse effects. So as we know, the psychiatric patients, as they keep on taking sedatives, so then they are become they become addicted to those drugs. But yoga therapy will not do that kind of effects. And yoga therapy is for these are the positive concepts or positive outputs of yoga therapy. With the specific yoga therapy, there will be physical, mental well-being of the patient, which medicine may not do that. There is no medicine for that, for the certain physical, mental well-being of the patient. With that, we all of us, yoga profession, we know about that. The quality of life of the patients will be enhanced, of course, and this is possible by the quality with the general health, like appetite, like sleep, and proportionate body weight can be enhanced. So for that, there is no medicine actually. And length of patient's life can be enhanced. So length of patient's life can be enhanced, as all the literatures of yoga, yes, keep on telling that, it delays aging process, it delays death. Of course, because of the regenerative, component of yoga therapy, it lengthens the lifespan of a patient. Of course, then the additional, concepts are yama niyama practices by which all the negativity of a patient can be, transformed into positivity. The patients, yes, the whatever, his animal beingness can be transformed into divine, beingness. And very beautiful is about the Satvikahara practice. Satvikahara practice of yoga therapy, it improves physical, mental, and spiritual health of a patient, where, there is no medicine for the spiritual health of a patient, to enhance the spiritual health of a patient. Of course, now scope of yoga therapy with conventional treatment, of course, present, with any treatment, or at present, yoga therapy alone can be, given to a patient with all the limitations as per patient's need. And yoga therapy can be as given with all the systems of medicine. There is no limitation for that, as well as for all the disorders with limitations, of course. And also yoga therapy, your present situation as lifestyle modifications, and with a lot of scientific evidences as per the literatures, as per the research outcomes. Also, as yoga therapy is used for research intervention in the benefit of patients. And of course, yoga therapy actually, yes, can be, patient can afford it with manageable cost. The Federation of State Medical Boards began to work on CAM guidelines for the physicians in 2000. The integrative or the initiative was focused on encouraging the medical community to adopt consistent standards, ensuring the public health and safety of facilitating the proper and effective use of both conventional and complementary and alternative medicine treatments. So, towards an interdisciplinary developed research agenda, CAM practices can be integrated into conventional medical practice, and supporting programs that develop models for the incorporation of complementary and alternative medicines into medical, dental, and nursing school curriculum, focusing on research, training, grants, funds, activities related to both clinical and basic research. Now, how yoga therapy can be standardized so that the scope can be enhanced? Of course, yes. It is all about the these important points. Yes, qualifications. There should be at least 5 years university qualifications for a yoga therapist, as equal to other streams of medicines. So 5 years qualifications in the field of yoga therapy from the universities, as same as other systems of medicine. And yoga therapy should be knowledge based. The knowledge, for yoga therapy with all the subjects of yoga therapy. And yoga therapy should be patient centered in the sense, yes, yoga therapy can be developed as per the literatures, as per the yoga therapist, as per the yoga techniques. But of course, the major component of yoga therapy is patient centered. With all the other developments, if it is not focused on the patient, about his condition, his disease, the severity of the disorder, the diagnostic criteria of the disorder, and yes, prognosis of the disorders, and all about, it should be patient centered. And of course, therapists should know about the limitations, proper limitations of yoga therapy, as well as application of yoga therapy, as well as limitations of patient with specific disorders or with multiple disorders. Also, yoga therapists should consider all those ethical issues and rules. This is very, very important. And also the rules which has been structured by yes, reputed yoga associations. Now, as I have told, to enhance the scope of yoga therapy, the knowledge-based yoga therapy is very important. Let us see what is knowledge-based yoga therapy and how to enhance it. What are the components of it? Yes, as per the literatures, to understand the preventive, promotive, and curative measures of yoga therapy, Heyam Dukkham Anagatam. Yes, it is called as preventive measures, prevention from the disorders. Tam Vidya Dukkha Sanyoga Viyogam Yoga Samjitam. Yes, this has been discussed, yes, under promotive measures of yoga therapy. Drishta Drishya Samyoga Heya Hetuhu Viveka Khyatihi Aviplavat Hanopayaha. Yes, this can be discussed under corrective measures, curative measures of yoga therapy. Of course, as all the systems of medicines are aiming at, yes, swastasya swasthya rakshanam aturasya roganat. Yes, protect the health, manage the better health, and to heal the disorders. As per that, one has to understand the literatures, yoga literatures, as preventive, promotive, curative measures of yoga therapy as per yoga literatures. Then all the literatures, so that all the techniques of yoga texts or literatures, one has to understand it. The techniques of Ashtanga Yoga, Hatha Yoga, Karma Yoga, techniques of Bhakti Yoga school, Dhyana Yoga school, Jnana Yoga school, Shraddha Traya Yoga school, Kundalini Yoga school, so that they can apply all the techniques specifically to the patient with complete literature knowledge. And also to have, they have to have knowledge of the development of yoga therapy. Actually, there is no yoga therapy in the literatures. There is, we get reference for yoga therapy, but systematically that has not been mentioned in the yoga literatures. But yes, since 80 to 90 years, how it has been developed in India and all over the world, the yoga therapist has to, understand that. As all of us, we know, one of the, yes, who has developed it, Swami Valayananda, he has developed it as per, modern medicine, and it is also considered as alternative medicine, as I have discussed, also complementary medicine, as by mind body medicine, as I have discussed, and the history of yoga, as well as, how it has been developed, also the, theories and research outputs about yoga therapy. The theories, yes, very important theories for the application of yoga therapy, like Panchaprana theory, Panchakosha theory, and Shadvimshati theory, Tridosha theory, and Triguna theories, as well as the yoga therapist should know about the proper meaning of yoga therapy, as yoga therapy is, yes, a system of complementary and alternative medicine, where the yoga techniques, yoga principles, yoga theories are used to treat all the disorders, as per patient's need. So this meaning, yoga therapist has to understand in a better way. Now, to enhance scope of the, yoga therapy, the concepts of the yoga therapy also should be, yes, very well structured and developed, and one has to understand it. So it is all based on the detailed case taking of a patient, as well as line of treatment in clinical setup. So that, yes, it should be, systematic treatment. So the concepts are, yes, while taking case history or while considering the line of treatment as well as while prescribing the specific yoga treatment, yes, it should be considered about the sthula sharira, the components of physiology and pathophysiology of the disorder, as well as tridosha balance correlated with the dhatu, agni and malakriyas. When it comes to the sukshma sharira, the components are prana functions as well as chitta vritti nirodha concepts correlated with indriyas, chitta and purusha. Ultimately, one has to know the transformation of a patient into sattvika guna, or this is called as developing spirituality in patients. Now one has to understand all the principles of yoga therapy, because the yoga therapy should be specific and prescribed. Yes, kriyas are the purificatory procedures other than other components or principles of yoga therapy like sattvika ahara, yamaniyama, asana, pranayama, bandha mudra, dhyana, shavasana. All these principles should be applied clinically with the meaning or concept of yoga. The concept of yoga is to join or union of Jivatma and Paramatma. When these principles are applied clinically to a patient, without this concept, it should not be, applied. So if it is applied, then only that is called as yoga therapy. So now to understand better clinical application of yoga therapy, yes, the yoga therapist should have well clinical experience, and it should be focused on patient care. This is very, very important concept, clinical experience for better patient care. And here it is not, student is taught yoga. Patient is treated by yoga therapy. So it is all about patient care on clinical experience. And importance of detailed case taking method is very, very important. The detailed case taking methods, as equal to other system of medicine, which becomes, age, gender, risk factors of the disorders, body constitution, and severity of the disorders, like that. So many, detailed case taking methods are there as per yoga, as per other systems of medicine, that should be developed so that the specific yoga therapy can be finalized. Then one has to adapt proper diagnostic criteria, methods. It may, if there is no proper diagnostic criteria in the literatures, then yes, of course, one has to depend on modern medicine diagnostic criteria. If the therapist is graduated in other systems of medicine, then as per that they have to adapt the diagnostic criteria for the better treatment of yoga. Then there should be counseling space for patients given. See, if the counseling space is given to the patient, then patient will become very confident about the yoga therapist, yoga treatment, as well as he'll develop self-confidence and he'll have faith about yoga therapy. It will affect in his better treatment. And therapist has to, yes, he has to figure out the line of treatment. So symptomatic treatment should be developed in yoga therapy. Causative treatment should be developed in yoga therapy. Ultimately, the well-beingness is always the ultimate effect of yoga therapy. Then there should be prescription of specific, yes, yoga principles in specific treatments, specific disorders. Means with all these backgrounds, one should be able to specify the yoga principles in specific disorders or in multiple disorders. Then one has to teach to the patients the systematic practicing method of those specific yoga principles. All of us, we know how yoga techniques can be systematically practiced for the better treatment, and effects. All of us, we know how the asanas should be practiced, how the pranayamas should be practiced, all the limbs should be practiced systematically, methodologically. And yoga therapist has to develop follow-up strategies, yes, to see the improvement in the patients, as well as to develop further yoga therapy as per the patient's follow-up. Yes, that has to be developed. And if the patients are referred from other clinicians, we have to discuss with those clinicians for the better yoga therapy with their knowledge. Then one has to develop feedback disciplines. Of course, these feedback disciplines should be documented so that we can, yes, go on constructing a better documentation, as well as better, treatments, better outcomes. Of course, then we have to, yes, teach patients, or, we have to educate patients about vairagya and abhyas, or abhyas and vairagya concepts, so that the implementation of yoga therapy will be a better treatment. Then we have to educate patient about the long-term practice of all those yoga principles. Long-term, it is not like drugs or medicines. You take it for 15 days, 3 times a day. You take it for 3 months, or you take it is for lifelong. But as per yoga therapist's advice, and as per the follow strategies, it has to be, yes, convinced, educated to the patient about the long-term practice, to yes, to get health, to get coordination or harmony, and to get well-beingness, also to cure the disorder. Yes. Now coming to the major aspect of scope, to enhance the scope of yoga therapy, that is to understand about the limitations of yoga therapy. Yes, all of us, we know the general limitations with medicines, what limitations should be considered. Without medicines, what are the limitations should be considered. And the limbs, about the limbs of yoga, what are the limbs can be practiced, what are the limbs cannot be practiced in all the specific disorders. And considering, yes, yoga therapy for a pediatric patient, considering yoga therapy for a geriatric patient, very important. They need very less practices for the treatment of their disorders and limitations. Yes, all of us, we know. Then about the cardiac disorders, ultimately cardiac patients, they need, yes, deep rest, or rest, so that we should not make them to practice many more practices as we teach for the beginners. No, they should be given rest, and further their efficiency of cardiac functions should be improved by the yoga therapy. Of course, psychiatric disorders, only mild and moderate categories can be treated with yoga therapy. The severe patients has to be, yes, referred to the psychiatrist. So orthopedic disorders, where severe yes, calcification is there, we should not do practical with those patients unless we have to refer them to the orthopedics. So wherever it is necessary, we should not waste the time. We have to refer the patients to, yes, the clinicians or the psychiatrists. Then of course we have to have limitations about the diet and lifestyle modifications as per yoga knowledge, not as per patient's knowledge, as per yoga literatures. Also, no, the diagnostic system, there is no diagnostic system. So yes, we have to depend on other diagnostic systems. There is no emergency treatment in yoga. So yes, it should be, we should refer to them for emergency treatment whenever required. And there is no surgical treatment. So equivalent to that, no treatments, yes, then we have to refer. There is no medicine in any form in yoga, that we have to understand. No treatment for severe illness. So like as I have told, angina pectoris and so many other severe disorders, then we should not waste our time. We have to take care of the patient. This is understood as patient care. And yes, now to discuss very less about the misconceptions in yoga therapy. Yes, most of us, we understand that yoga teaching same to yoga practice and in yoga therapy. No, it is totally different. Yoga teaching to a student is very different, but you giving yoga therapy is for a patient. So many concepts should be considered when we give yoga treatment. So when we give yoga treatment, it is all about patient, his disorder and the limitations, as we have discussed. and application of Abhyasa and Vairagya is must. It is not the misconception. Application of Abhyasa, as we know, same with Vairagya, it should be very, very important. And yoga is not designed for as therapy. Yes, many of them, they yoga profession or therapists think that yoga is not designed for the therapy. Let me give general treatment, general yoga course to all, even to the aspirants, to the patients also. No, it is not such. Yoga therapy also is also developed, and we have discussed on that. And yoga therapists, it is a misconception. They never focus on the ethical considerations. Patient is there, so there should be ethical consideration. One should not forget it. One should not, delete from the yoga therapy, system. Then ignorance about patient's life and death, it should not be done. When whenever it is required, the patient should be referred, may be continued with yoga therapy. Yes, ignorance about other systems of medicine. See, other system of medicine, they are not opposite to yoga therapy. They are not opposite to yoga therapy or complementary and alternative systems of medicine. Actually, we should not ignorant about other system of medicine. We should learn what exactly the other system of medicines say. We have to learn the summary of that. And ignorance about yoga as, yes, CAM or system of medicine. Yes, we should not think that yoga is the mainstream of medicine. Of course, it may be as per us, but we should consider it as a, yes, system of complementary and alternative medicine, and we have to, enhance the scope of yoga therapy. And yes, to conclude, yes, peace of mind is half cure, which can be done with, yoga therapy. Emergency medicine is always modern medicine, always modern medicine. So, yoga therapy is for longer duration. Yes, if the patient requires, as per his need, yoga therapy is for longer duration. And that is, one has to have, yoga therapy is comprehensive about health and well-beingness. And yoga therapy needs lifelong dedication to cure patients. This is very important. It is not just, take care of the patient with the teaching for 10 days, 15 days, for 3 months and all. Yoga therapist has to develop dedication, lifelong dedication to cure his patients. It is a person's life, needs deeper attention. Yes, when we take patient care with yoga therapy, we have to understand it is a person's life. So it needs deeper attention. Yes, then yoga therapist has to commit there should be commitment, so that we are extending somebody's life as long life. And I would conclude with this statement. It was observed that in the past, yoga teachers taught yoga only to their few students and refrained from publicity. Yes. On the other hand, we have seen, and we can see an explosion in the number of quacks who claim to cure any disorders, anything instantly with yoga. So let us work on to become genuine yoga therapist, not the quacks, to become genuine yoga therapist. So let us work on to enhance the scope of yoga therapy as a complete system medicine, as well as a complementary and alternative system of medicine. With this, I can conclude my today's session. I give my thanks to the, yes, chairperson, sir, Dr. Krishna Sharma, and all the members of the organizing committee to invite me to give a session on this topic, as well as I give my thanks to all the participants. Yes, namaste.